Welcome to the Explainer. You know, a lot of people think CNA test prep is just about memorizing answers to pass an exam. But today, we're going to flip that on its head. We're taking those questions and turning them into something much more powerful. A real-world blueprint for providing truly excellent, compassionate care.
So, let's start with the big question, right? What's the real difference between just good care and great care? Well, good care is about getting tasks done, checking boxes. But great care? That's about understanding the why behind every single thing you do. It's a whole mindset that puts the entire person, not just the patient, front and center.
And to build out that mindset, we need a solid framework. And for that, we're going to use a classic, Maslow's hierarchy of needs. Now, this might seem like textbook stuff, but it's an amazing tool. It shows us how human needs stack on top of each other, from the absolute basics like breathing, all the way up to feeling safe, connected, and respected. For a CNA, this isn't just theory. It's your roadmap for prioritizing care every single day.
So here's how we're going to break it down. We'll start at the bottom with the absolute foundation, physical needs. Then we'll build up to creating a safe haven. Then focus on dignity and connection. And finally, we'll talk about the professional standards that pull it all together.
Okay, let's dive right in at the base of that pyramid. We're talking about the absolute non-negotiables: oxygen, water, food, basic comfort. Before anything else can even happen, these needs have to be met. This is square one, where a CNA's vigilance is absolutely critical.
You know, a huge part of physical care isn't just doing things for a patient. It's actively preventing things from getting worse. And a big one is this: atrophy. It's what happens when muscles weaken and shrink because they're not being used. Understanding this is the first step in fighting against it.
All right, this number right here, 2 hours. Burn this into your brain. For a patient who can't move on their own, this is the magic number. It's the maximum time between repositioning them to prevent incredibly painful pressure sores and protect their skin. It is absolutely crucial.
And here's what all that looks like in the real world, day to day. Offering a drink every few bites, providing pericare on that 2-hour schedule, helping someone sit up for mouth care. It's all these small, consistent actions that really form the bedrock of excellent physical care.
Okay, so once that physical foundation is stable, we move up to the next level. The next priority is making sure the patient's environment is a total safe haven. This is all about protecting them from falls, fires, infections, any kind of potential harm.
In an emergency, clear thinking is what saves lives, and the RACE protocol for fires is a perfect example of that. It's not about panicking. It's a simple, 4-step action plan you can follow: rescue, alarm, confine, and then extinguish or evacuate. Knowing this by heart is a massive part of your responsibility.
You know, safety is often just as much about what you don't do as what you do. On one hand, you're actively getting rid of hazards like throw rugs and using tools like a gait belt. But on the other hand, you're making sure you never let clutter build up or, and this is a big one, restrain a patient on your own.
And I really want to focus on that last point for a second, because restraining a patient without an order is so serious, it has a legal name: battery. It's illegal, period. End of story. It violates their rights, and honestly, it puts everyone in serious danger.
So, we've met their physical needs and we've made their world safe. Now we can focus on what I think is the real heart of caregiving. This is about seeing the person, not just the patient. It's about dignity, connection, communication, meeting those needs for acceptance and respect.
Just listen to how powerful this simple phrase is. When you see a patient who's upset or withdrawn, this is how you connect. You're not making assumptions like, "Are you sad?" You're just making a gentle observation and then an invitation. You're showing them, "I see you and I care." It's huge.
And the way you phrase a question can literally change everything. A closed question like, "Do you need anything?" usually just gets a no. But an open-ended question like, "How can I help you?" well, that invites a real conversation. It gives the person control and shows you're genuinely interested in what they have to say.
And all of these little things, they're direct ways of upholding a person's rights. Knocking on the door respects their privacy. Letting them choose their own clothes respects their autonomy. This is how you show someone you see them as a capable, whole individual, not just a list of tasks.
This brings us to the very top of our pyramid, the capstone that holds everything else together. You, the professional caregiver. This level is all about understanding your specific role, knowing your boundaries, and always acting with integrity.
So let me throw a situation at you, one that happens all the time in the real world. A nurse, your supervisor, asks you to do something you haven't been trained to do. The pressure is on. What's the right move? What's the professional move?
And the answer, really, is simple and non-negotiable. Your number one duty, above all else, is to patient safety. That's it. So it's your professional responsibility to politely but firmly say no to any task you aren't trained for. Now, this quote, it's a sobering one, but it's an important reminder of what's at stake. It comes from a scenario where hourly rounds were delayed, a patient fell, and the outcome was tragic. When things go wrong, the only professional response is the honest one. Accountability means reporting the facts clearly. Every single check-in matters. Being a professional really comes down to knowing your role in these specific situations. You never document for someone else. You refer questions you can't answer to the nurse. You report any change, no matter how small, immediately. And you speak up if something doesn't feel right. This is what makes you such a vital part of the healthcare team.
So in the end, passing a test is about knowledge. But the job, the actual work of caring for another human being, that's about wisdom. It's about taking that knowledge and applying it with compassion, with integrity, with real respect. It's the difference between just doing a job and answering a calling. The real question is, are you ready to provide not just good care, but great care?